and welcome to today's lecture on cannabis and cocaine, the second half of Deliriant. In the previous lecture, we studied about Dhatura. Cannabis, also known as Indian hemp or pot or dope or grass, is a genus of flowering plants that includes three species. One is Cannabis sativa, second is Cannabis indica, and third one is Cannabis ruderalis. All three are found in India, Central Asia, and South Asia. It is one of the oldest drug of abuse and has been known to man since about 5,000 years. It has been used by inhabitants of India and Nepal since that time and was then referred to as Ganjika. It's a Sanskrit. Cannabis is an annual dioecious, that is male and female plants occurring separately, flowering herb. The leaves are digitate with serrate leaflets. The first pair of leaves usually have a single leaflet. The number gradually increases up to a maximum of about 30 leaflets per leaf, usually 7 or 9, depending on variety and growing conditions. Female plant is taller, that is approximately 4 to 6 meters, and has darker and more luxuriant foliage than the male. It also produces more of the glandular trichomes and as a consequence is richer in cannabinoids. Cannabis sativa is taller, more highly branched, and typically represents fiber type varieties. Cannabis indica is shorter with broader leaves and typically represents strains used for recreational or medicinal purposes. If we talk about Cannabis ruderalis, it has a bushy appearance and has low levels of cannabinoids. Currently, cannabis is the most commonly used illicit drug of abuse. If socially acceptable drugs are also taken account, then it is the fourth most common drug of abuse after caffeine, nicotine, and alcohol. Coming to the toxic principles, these toxic principles or the active principles are called as cannabinoids or also known as phytocannabinoids, which are secreted by trichomes. And the cannabinoids of importance are THC, that is tetrahydrocannabinols, then cannabinol, then cannabidiol, and cannabidiolic acid. The most important THCs are delta 8 tetrahydrocannabinol and delta 9 tetrahydrocannabinol. If we talk about the fatal dose and fatal period, fatal dose for THC is 30 mg per kg body weight. For charas, it is 2 gram per kg. For ganja, it is 8 gram per kg. And for bhang, it is 10 gram per kg. While fatal period is of several days. Coming to the mechanism of action, endogenous cannabinoid receptors. These cannabinoids exert their effect by interaction with specific endogenous cannabinoid receptors, as for example, CB1, CB2, GPR18, GPR55, and GPR115. These GPR are nothing but G protein coupled cannabinoid receptors. Then the second part is endogenous cannabinoids, that is anandamide. It is derived from a Sanskrit word anand, meaning happiness. It is an endogenous cannabinoid that attaches to these receptors. It produces natural pain relief and controls the immunity. Third part of mechanism of action is THC, that is additionally acts on CB1 and enteric nervous system to suppress the emetogenic stimuli communicating between them. Thus, it acts as an effective anti-emetic. Forms of cannabis. So there are 6 forms of cannabis. Firstly, bhang, also known as patti, siddhi or sabji. It consists of dried mature leaves and stems of cannabis. It is the mildest form of cannabis and contains 15% of the active principle. Fresh bhang is more potent and it loses its potency on storage. Its toxicity lasts for about 3 hours, ending with sleep. It is used to produce a cheerful mood, as an appetizer, and for enhancing sexual pleasure. It is consumed in various forms, such as a pill or bolus. In this, leaves are rubbed with black pepper on a stone and then sugar is added to make a pill or bolus, also known as bhang golis or pods. Second form is mixed with milk. In this, almonds and spices, mainly black pepper, are also added and served on festive occasions such as Holi. And the third form is tea. So, cannabis tea leaves boiled in water just like tea leaves. So, second form of cannabis after bhang is majun. It is nothing but a sweet prepared with bhang. It is made by mixing bhang with honey and ghee. Sometimes henbane, datura seeds and poppy seeds are also added. Coming to next is ganja or marijuana. It is a rusty green powder with a characteristic odor, which is prepared from flowers of female plants. It is a stronger form of cannabis and contains 15 to 25% of active principle. It is used in various forms such as smoked in a pipe, that is chilam or hookah, and in the form of cigarettes that are known as reefers or joint. Next form is charas or hashish. It refers to the dried resin of cannabis. It contains about 25 to 40% of the active principle. Its slang names are dope and shit. It is dark green or brown in color and mixed with tobacco and smoked just like ganja. There is one more terminology, garda. It is a highly purified form of hashish, as it is free from additive chemicals made in northern tribal areas of Pakistan and Afghanistan. It is called garda, that is dust, due to its similarity in color to mud. Coming to the next is hash oil. It is a high concentrated solution of THC, approximately 70 to 90%, produced by a solvent extraction of cannabis. It is thus a tincture or extract of cannabis. Next form is sinsemilla. It is a Spanish term in which sin stands for without and semilla stands for seed, meaning without seed. It is a highly potent variety of cannabis produced in such a way that only the female plant is allowed to blossom. Without pollen from the male plant, the female flowers produces no seed. The last form is marijuana blunts, that are cheap cigars sliced open, packed with cannabis and resealed. Coming to clinical features, which is divided into two categories, that is acute poisoning and chronic poisoning. Coming to acute poisoning, there will be euphoria, then temporal and spatial disorientation with intensification of sensations. In this, colors become brighter, sound becomes more distinct, music is heard with heightened fidelity, and there will be increased clarity of perception. At high doses, the user experiences hallucinations, sedation, and sometimes dysphoria, characterized by unpleasant sensations, fear, and panic. Sometimes, an acute toxic psychosis is precipitated with suicidal ideation, anxiety, and paranoia. Other than this, we also find tachycardia, palpitation, hypotension, stimulation of appetite, and eyes will be bloodshot due to conjunctival congestion. Second category is chronic poison. In chronic poisoning, first of all, we find amotivational syndrome. What is this amotivational syndrome? Chronic indulgence is said to induce an amotivational syndrome characterized by apathy, poor concentration, social withdrawal, and lack of motivation to study or work. Heavy cannabis users demonstrate an increased tendency to develop manic, schizophreniform, and confusional psychosis over a period of time. Running amok is a psychiatric condition in which a person runs about deliriously killing anyone who comes in way, also called as killing spree. First of all, there will be a period of depression, followed by sudden running around and killing people with whatever comes in his hand, knife or gun or anything. Then there will be depression once again, during which he either commits suicide or surrenders himself to the police. Other than these, there are medical complications also, as for example, chronic lung disease and carcinogenesis, cancer of mouth and larynx, and aspergillosis. Coming to diagnosis, in case of acute ingestion, there is a test called as RIA test or radioimmunoassay test for delta 9 THC in blood, and it can be detected within 4 hours of use. In case of chronic use, urine RIA for delta 9 THC yield positive results 4 to 10 days after smoking marijuana in a first-time user and for as many as 36 days after cessation in chronic users. There are 3 color tests also. One is Dracunoise Divine test. Then the second one is Fast Blue B Salt test. And the third one is Para-DMAB test. That is Para-dimethyl amino benzaldehyde test. And lastly, the diagnosis can also be done by thin layer chromatography. Coming to the treatment, again treatment is divided into 2 parts, acute poisoning and for chronic poisoning. For acute poisoning, first of all, decontamination measures in case of ingestion. For this, stomach wash or MSS can be done, followed by activated charcoal. In case of acute psychotic reactions, we have to give benzodiazepines, and other than this, supporting measures are given. If we talk about chronic poisoning, then psychosocial therapy, consisting of attempts to promote realistic and rewarding alternatives to the drug and associated lifestyles, along with the commitment to abstinence from self-administered or unprescribed psychotropic drugs. Second one is drug-focused group therapy, comprising strategies such as social pressure to reinforce abstinence, teaching socialization and problem-solving skills, and reducing stress. Thirdly, short-term use of anxiolytic agents such as benzodiazepines may be necessary in some cases when anxiety symptoms are severe. And lastly, the short-term use of antipsychotic medication may be required if there are persistent delusional ideas or frightening flashbacks. Coming to autopsy finding, these are not characteristics, but we can find few signs of asphyxia. Lastly, the medical legal importance. So, cannabis is used as an aphrodisiac, as a stupefying poison, and it is sometimes taken by the criminals themselves to gather courage before committing a criminal act. Fourthly, second-hand marijuana smoke is when a person may passively inhale marijuana smoke from the environment if an addict is smoking nearby. If we talk about the manner of poisoning, it can be due to abuse, accidental, suicidal, or homicidal. Most of the case of poisoning is by abuse. There can be accidental ingestion or inhalation. Suicidal is extremely rare, and homicidal is not possible because of large fatal dose and the peculiar odor. Now, moving on to the next ingredient, that is cocaine. It is also known as coke, devil's dandruff, lady, she, or snow. It is a natural alkaloid present in the leaves of the coca plant, that is Rathoxylon coca. It is a shrub that grows well in South America Mexico, Indonesia, and West Indies. Cocaine is a colorless, odorless, crystalline substance with a bitter taste. Now, you can see the cocaine powder as well as the plant of coca. So, this cocaine was first isolated from the plant by Friedrich Gadig, a German chemist, in 1855. 4 years later, that is in 1859, Albert Niemann improved the purification process. In 1879, Vasily von Henry of the University of Würzburg demonstrated its analgesic properties. It was introduced into clinical use as a local anesthetic in Germany in 1884. Its use as a modern anesthetic is limited because of its intense vasoconstrictor activity and potential for cardiovascular toxicity. The alkaloid cocaine comes from the leaves of Cathoxylon coca. A coca leaf typically contains less than 2% cocaine. By treating the leaves with sulfuric acid, cocaine sulfate is produced, which in turn is converted to cocaine hydrochloride. This cocaine hydrochloride contains 90% cocaine and is either snorted or injected. It cannot be smoked as its vaporization point is high, at which cocaine disintegrates. A smokable form of cocaine, that is free cocaine or free base or crack, because it makes a crackling sound when heated, is produced by treating cocaine hydrochloride with baking soda. It is the second most commonly used illicit drug of abuse after cannabis. Coming to the mechanism of action. So, it works by two mechanisms. One is blocking the uptake of biogenic amines and increasing excitatory amino acid concentration in brain. It blocks the reuptake of biogenic amines such as dopamine, norepinephrine, epinephrine, and serotonin. So, what will happen after this? After this, there will be increased epinephrine, which leads to tachycardia. Increased norepinephrine will lead to hypertension, and increased dopamine and serotonin will lead to reward and then cocaine addiction. Increased serotonin also causes seizures. Then the second mechanism of action is it increases excitatory amino acid concentration in brain, that is psychomotor agitation, hyperthermia, and seizures. Coming to fetal dose and fetal period. Orally, fetal dose is about 500 milligram. If we talk about the mucosal contact, it is 100 milligram, and the lethal blood level is 0.2 milligram per 100 ml. And the fetal period is few minutes to few hours. Now, clinical features again divided into two: acute poisoning and chronic poisoning. First, acute poisoning. On smoking and IV administration, the onset of action is within 1 minute. Peak action is 3 to 5 minutes. In case of nasal insufflation, the onset of action is in 1 to 5 minutes, while peak action is in 20 to 30 minutes. If we talk about the oral ingestion, the onset of action is in 30 to 60 minutes, while peak action is in 60 to 90 minutes. Now, if we talk about the clinical features per se, then initially there will be bitter taste, dryness in mouth, dysphagia, euphoria, then headache may also occur due to vasospasm. Then there will be sympathomimetic toxidrome, that is, there will be arrhythmias, diaphoresis, hypertension, hyperthermia, that is also known as cocaine fever, mydriasis, and tachycardia. Coming to the next clinical feature, it is neuropsychiatric manifestations. In this, there will be hypomaniac picture with increased psychomotor activity, increased speech output, agitated delirium, grandiosity, elation of moods, and hypervigilance. signs along with seizures. If we talk about eyes, there will be acute angle closure glaucoma due to mydriasis. There will be loss of vision because of vasospasm of retinal vessels, and then there will be metarosis, which is nothing but loss of eyebrow and eyelash hair, which occurs from thermal injury associated with smoking crack cocaine. Coming to the next clinical feature, it is crack dancing, which is choreoathetoid movements due to dysregulation of dopamine. Lastly, there will be asthma-like symptoms. Smoked cocaine, not IV cocaine, produces asthma-like symptoms such as cough, shortness of breath, and wheezing. This is because of thermal insult to bronchi and AEME, that is anhydroecogonine methyl esters. It is a unique pyrolytic metabolite of cocaine which produces bronchospasm. Now, coming to chronic poisoning, also known as cocainism or cocainophagia or cocainomania. First and the most important is Magnus symptom, also known as cocaine bugs or formication. It is illusory sensation of hands crawling under the skin. The patient scratches his skin as a result, causing irregular scratches or excoriations and ulcers. In this, if we come to nasal septum, then there will be perforation due to necrosis, which in turn occurs due to vasospasm and enhanced coagulation. And we have granulomas of the nasal septum. The perforation of the nasal septum reduces the nasal support and results in a broad, flat nose that is known as saddle nose. If we talk about the perforation of the palate, the addicts with a palatal perforation suffer from serious speech impairment. Their speech becomes hypernasal and articulation may be so poor that they cannot communicate effectively. In addition, eating and drinking is difficult due to oronasal reflux of both solids and liquids. Then the next feature is pain in abdomen. This pain in abdomen is because of gastric ulceration due to local ischemia of GIT, increased acid production associated with sympathetic activity. Teeth are black, as seen in chronic cocaine abusers who rub cocaine on their gingiva. In some cases, the teeth may have a smooth and glossy appearance because cocaine results in substantial decrease of salivary pH. The tongue will be black. There will be a process which is known as bruxism, means grinding of teeth accompanied by clenching of the jaw. It occurs frequently in cocaine addicts. It gives rise to pain in the temporomandibular joint and masticating muscles. Next feature is crack eye, means there will be corneal defects. And lastly, cocaine use during pregnancy. If a mother uses cocaine during pregnancy, then the babies born to those mothers will show congenital anomalies and low birth weight. So these babies are known as crack babies. Cocaine withdrawal. This cocaine withdrawal is divided into three phases: phase 1, phase 2 and phase 3. Phase 1 is known as crash, while phase 3 is known as extinction. Coming to the phase 1, that is crash. The total duration of this phase lasts for anywhere between 9 hours and 4 days. It is subdivided further into early, intermediate and late. In early, we have features such as agitation, depression, anorexia, intense craving for cocaine. In intermediate, we have fatigue and tendency to sleep and decreased cravings. And in late, we have exhaustion, hypersomnia, hyperphagia and absence of craving. Moving on to phase 2, there will be normalized sleep, improved mood, followed subsequently by return of anergia, anhedonia, anxiety, and increased craving. Lastly, the phase 3, that is the extinction phase, there will be increased tendency to relapse. Coming to diagnosis, cocaine and its metabolite, that is benzolactone, can be detected in blood, urine, saliva, and even hairs. If we talk about ECG, then it shows widening of the QRS complex. X-ray reveals cocaine packets in cocaine body packers. Then there are two other tests which is used to diagnose cocaine, that is gold chloride test and Scott test. Coming to the treatment, first of all, treatment of acute poison. First of all, gastric lavage should be done with warm water containing KMNO4 if it is taken orally. And if it is snuffed, then nasal irrigation with sodium chloride. Other than this, we can also give activated charcoal. In case of hyperthermia, minimize the physical activity and sedate with benzodiazepines. Ice baths and packs can also be used. In case of anxiety and agitation, either give diazepam 5 to 10 mg IV or lorazepam 2 to 4 mg IV. In case of convulsions, same thing you have to give either diazepam or lorazepam. Along with this, you can also give phenobarbital, that is 25 to 50 mg per minute up to 10 to 20 mg per kg. For hypoglycemia, hypertonic dextrose can be given. And lastly, for hypertension, use direct acting vasodilators, that is nitroglycerin or nitroprusside, or alpha adrenergic antagonist, that is phentolamine. Coming to the treatment of chronic poisoning, drugs for reducing the cravings should be given, as for example, amantadine or bromocriptine. Then, drugs for both reducing craving and for antidepressant effects can also be given, as for example, desipramine, imipramine, and trazodone. And lastly, psychosocial management techniques. These are useful in the post-withdrawal treatment and in prevention of relapse. It includes contingent behavior therapy and supportive psychotherapy. Autopsy findings. Autopsy findings is divided into two: external findings and internal findings. If we see externally, the nasal septum will be perforated. The nasal swabs and the injection sites would reveal cocaine, and there will be burning over the oropharynx because of inhalation of superheated fumes of cracked cocaine. If we go to the internal findings, then the nasopharynx and the nasal passages will show congestion. The GIT will show mucosal edema as well as congestion. Brain will show subarachnoid, intraventricular, intraparenchymal hemorrhages. And last, lungs. In lungs, we found cracked lung, that is diffuse alveolar hemorrhage. Along with this, we also find pulmonary infarction, pneumothorax, and pneumomediastinum. Now lastly, the medical importance. First of all, Brompton's cocktail. Brompton's cocktail is a mixture of cocaine, morphine, or heroin along with chlorpromazine and alcohol. It is sometimes provided to the patients suffering from pain associated with terminal illnesses such as cancers. Second medical importance is in case of prostitutes. So prostitutes sometimes inject cocaine into vagina to produce local constrictions. Third medical importance is speedball. It is nothing but a combination of cocaine and heroin taken by injection. And lastly, we have body packer syndrome and body stuffer syndrome. In case of body packer syndrome, the person engaged in smuggling of cocaine filled the drug in balloon or condom or polythene bag and swallowed to conceal the contraband. This act is called as body packing. The packets may cause intestinal obstruction. Sometimes sudden death may be caused due to rupture of the bag or condom within gastrointestinal tract. Lastly, body stuffer syndrome. The person who smuggled the cocaine on the verge of being arrested for possessing cocaine swallows the drug to conceal the evidence. This act causes cocaine poison. Thank you.